Welcome to Understand Psoriatic Arthritis. I'm Jack March, the Rheumatology Physio, and in partnership with Cetra Health, we are going to explore the condition Psoriatic Arthritis, or PSA, its causes, risk factors, symptoms, diagnosis, treatment, and outlook. This video forms part of a series that covers lots of different conditions, from psoriatic arthritis to spinal osteoarthritis. You can find all of these on this YouTube channel and at cetrahealth.com, which also has downloadable information sheets on all of the conditions covered. Please leave questions on the video. I read and reply to all of them. And for now, welcome to Understand Psoriatic Arthritis. Psoriatic arthritis is a rare type of arthritis that affects people who have the skin condition psoriasis. It causes affected joints and tendons to become painful, swollen, and stiff. Symptoms can vary significantly from person to person and may come on suddenly or slowly over time. Fortunately, with medication and a healthy lifestyle, most people with psoriatic arthritis can effectively manage their condition and maintain a good quality of life. Causes and risk factors. Psoriatic arthritis is caused when the immune system starts to affect the body's own tissues by mistake. It causes an inflammatory reaction to the tissues of the joints, tendons, and ligaments, which causes them to become inflamed and eventually irreversibly damaged unless treated. The onset of psoriatic arthritis is most commonly between 30 and 50 years of age, but can be younger or older. Approximately 1/3 of people with psoriasis will develop a psoriatic arthritis. Psoriasis and psoriatic arthritis are autoimmune conditions, meaning the immune system mistakenly affects the body's own tissues. About 1 in 3 people with psoriasis will develop psoriatic arthritis. It is rare to develop psoriatic arthritis without noticeable patches of psoriasis. Symptoms. The symptoms of psoriatic arthritis include pain and swelling in affected joints, pain and swelling in affected tendons, stiffness and reduced range of movement in affected joints, nail changes like yellowing, denting, or breaking, tender heels or back pain, and fatigue. The knees, ankles, hands, and feet are the most commonly affected. Diagnosis. There is no single test that can diagnose psoriatic arthritis, so a diagnosis usually involves a combination of factors, including physical examination of the joints, assessing for swelling, range of motion, and other signs of inflammation, blood tests to investigate the presence of increased inflammation, and a genetic test called HLA-B27. This is a human leukocyte antigen. About 50% of people with psoriatic arthritis will be HLA-B27 positive, comparative to about 8 to 12% in the rest of the population. Imaging tests with either ultrasound or MRI can also be used. Treatment. There is often a crossover between treatment for psoriatic arthritis and psoriasis. Options include medications such as non-steroidal anti-inflammatory drugs or NSAIDs like ibuprofen or naproxen, biological therapies, disease-modifying anti-rheumatic drugs or DMARDs like methotrexate, and corticosteroids like prednisolone. Lifestyle modifications such as activity levels at the recommended weekly amount of 150 minutes of moderate intensity, range of motion and strength exercises to improve the function of specific joints, reducing smoking and alcohol consumption, and a healthy, balanced diet including sufficient protein intake. With psoriatic arthritis, an active approach is key, and you should try to gradually return to your normal activities. This includes hobbies and occupational activities like work. Seek help from healthcare professionals if you are struggling with any specific tasks. Complications. Having psoriatic arthritis can put you at risk of developing other conditions in the eye, gut, bowel, and spine. It is advisable to regularly attend appointments with your specialist medical team and always speak to them about any concerns you have regarding other signs and symptoms that may be new. Outlook. Psoriatic arthritis is a long-term progressive condition if left untreated. While some people experience mild joint pains, others may develop widespread pain, swelling, and stiffness. Most people with psoriatic arthritis can expect to lead a relatively normal life with appropriate treatments. Early diagnosis and treatment are critical in managing the symptoms of psoriatic arthritis and preventing long-term complications like joint damage in the fingers. And that's a wrap for this part of the series, Understand Psoriatic Arthritis. I'm Jack March, the Rheumatology Physio, and thank you to my partners at Cetra Health for providing the visuals for all of these videos. You can find information on lots more conditions right here on this YouTube channel, and for more in-depth information and downloadable resources, head over to cetrahealth.com. Have questions or thoughts about what we've covered? Drop them in the comments below. I make it a point to read and respond to every single one. Until next time, thank you for joining me on this journey to understand psoriatic arthritis. Stay curious, stay informed, and most importantly, stay healthy.